From January of this year, tell me about just one specific moment when you had that sinking feeling in the pit of your stomach because you were not seeing the response that you knew needed to happen.
Congressman, I'll never forget the emails I received from Mike Bowen and indicating that our mask supply, or N95 respirator supply was completely decimated. And he said, we're in deep shit. The world is, and we need to act. And I pushed that forward to the highest levels I could in HHS and got no response. From that moment, I knew that we were going to have a crisis for our healthcare workers because we were not taking action. We were already behind the ball. That was our last window of opportunity to turn on that production to save the lives of those healthcare workers, and we didn't act.
To take immediate action when you correctly pushed to acquire additional doses of the drug remdesivir?
There was no action taken on the urgency to come up with a plan for acquisition of limited doses of remdesivir, nor to distribute those limited doses of remdesivir once we had the scientific data to support their use for people infected with this virus.
And instead of acting on your recommendations, was the response of others to try and cut you out of key meetings, marginalize your participation?
I was told that my urgings were causing a commotion, and I was removed from those meetings.
You discuss a February 7th meeting of the department leadership group at which you urged the department to focus on securing N95 masks. Can you describe what happened at that meeting?
They informed me that they did not believe there was a critical urgency to procure masks. They conducted some surveys, talked to a few hospitals and some companies, and they didn't yet see a critical shortage. And I indicated that we know there will be a critical shortage of these supplies. We need to do something to ramp up production. They indicated if we notice there is a shortage that we will simply change the CDC guidelines to better inform people who should not be wearing those masks, so that would save those masks for our healthcare workers. My response was, I cannot believe you can sit and say that with a straight face. That was absurd.
In fact, it took 3 months from your initial warnings until mid-April for the federal government to invoke its authority under the Defense Production Act to require the production of millions of more N95 masks. And even then, the administration required the production of only 39 million masks, which is far fewer than you and other experts said that we would need. What was the consequence of this 3-month delay and inadequate response? Were lives endangered?
Lives were endangered, and I believe lives were lost. And not only that, we were forced to procure these supplies from other countries without the right quality standards. So even our doctors and nurses in the hospitals today are wearing N95 marked masks from other countries that are not providing the sufficient protection that a U.S. standard N95 mask would provide them. Some of those masks are only 30% effective. Therefore, nurses are rushing in the hospitals thinking they're protected, and they're not.
And Dr. Bright, you contend that your removal was because the Trump administration and HHS leadership in particular lacked scientific integrity. Do you think that Dr. Fauci lacks scientific integrity?
Sir, I don't think my removal has anything associated with Dr. Fauci at all. I think my removal was because of tensions and actions I took between my advisor, my supervisor, Dr. Cadillac, and myself.
Do you know about Dr. Fauci's testimony 2 days before at the Senate Health Committee?
I'm aware of that testimony, yes.
If HHS leadership is so hostile to scientific integrity, as you say, as you allege, how do you explain Dr. Fauci being allowed to testify forthrightly, to serve in a prominent role on the White House task force, the administration, and direct NIAID's extensive research efforts?
So I'm not sure what decisions are involved in allowing Dr. Fauci to testify or not. That's not something.
Can you say that again?
I'm not sure. I'm not aware of what process or decisions are involved in allowing Dr. Fauci to testify or not.
But he was allowed to testify.
I know he was, but I thought I understood you to ask me if that was appropriate or if he was not being allowed to.
You identified yourself at this hearing, got noticed. I'm hearing from a lot of doctors, my state, around the country, who have experience using hydroxychloroquine and chloroquine, coupled with erythromycin and zinc, and they're reporting significant benefit if it is used early enough in the course and may eliminate the need for hospitalization and ventilatory support.
gentleman's time
I
has
don't know if that's
expired.
right,
The
but I think
gentleman's
it's
time has
important enough
expired.
that we should look into it, and would just be interested if you did that as part of your duties at BARDA.
The gentleman's time has expired. The
May the
chair now
gentleman answer the question?
recognizes,
Would the witness be able to answer the question?
you may,
So I believe it's important. I've heard those anecdotal stories as well, and they were not conducted in the context of a randomized controlled clinical study. It's very difficult to understand data from those types of observational studies or anecdotal stories. So the drug might have some benefit in some populations, but we won't know that until we have that information from a truly randomized controlled clinical study. Many of those studies are ongoing now. Some of those studies we're starting to see data from, and those studies in those populations tested haven't shown an overwhelming evidence of benefit from the use of hydroxychloroquine in those patients. But the different studies are devised to look at different angles of it, as you described.
Where we are now in the hunt for a vaccine and where we could have been had the HHS leaders made investment decisions sooner that were based on scientific merit.
Thank you, Congressman. As we all know, vaccines are very difficult to make. It's nothing that you can do quickly, and you need multiple shots on goal to try to make a vaccine. There are many diseases we've attempted to make vaccines for through history, and we still haven't been able to do so. So it takes many opportunities and many different approaches. Right now, there are over 100 different approaches for developing a vaccine for this coronavirus. So we're confident that hopefully, I should say, at least one of those or two of those will work, but you've identified key critical challenges that we need to anticipate and prepare for early. Number one is the supply chain for those vaccines, needed reagents and buffers and salts and various ingredients that go into a vaccine, as well as the glass vials that the vaccines are put into, and needles and syringes, and then a carefully coordinated distribution and administration strategy. We haven't yet gotten to those downstream strategies yet in our government, and I think those are going to become a significant issue down the road if we don't plan for that now.
Doctor, if you were a betting man, when would you bet that we would time and that we would have a vaccine?
That's a very difficult question to answer. I know that there are companies in academic labs working very hard. Normally it takes up to 10 years to make a vaccine. We've done it faster in emergency situations, but from when we had starting material in the freezer for Ebola, but for a novel virus, it's actually haven't been done yet that quickly. So a lot of optimism is swirling around a 12 to 18 month time frame. If everything goes perfectly, we've never seen everything go perfectly. My concern is if we rush too quickly and consider cutting out critical steps, we may not have a full assessment of the safety of that vaccine. So it's still going to take some time. I still think 12 to 18 months is an aggressive schedule, and I think it's going to take longer than that to do so.